As Americans, we live in a country where medical breakthroughs happen every day. In many ways, we are living in the golden age of medicine. But none of that matters when regular people cannot afford the medicine they need to survive. In Maine, we were tired of waiting for the politicians in Washington, D.C. to stand up and do what's right. So we rolled up our sleeves and took on Big Pharma ourselves. And we won. At the start of this session, Governor Janet Mills, Speaker Sarah Gideon, and I set out to make healthcare more affordable, reliable, and accessible for Maine people. We knew it wouldn't be easy. We knew that lobbyists and special interests would throw up roadblocks. We knew that we'd have to cut through partisan bickering to get results. And most importantly, we knew Mainers couldn't afford to wait any longer for access to affordable health care. Nearly every day, there's another heartbreaking story grabbing national headlines about someone's brother, sister, parent, or child who died because they couldn't afford their medication. It's tragic, but unfortunately, it's all too familiar. These deaths could and should have been prevented. I know, because it's what I've heard from hardworking folks in my districts for years. The situation with prescription drugs is unique to this country, and it's out of control. Pharmaceutical companies have had unprecedented and unregulated power for far too long. In Maine, we were tired of hearing these stories and not being able to do anything about it. We passed a suite of bold prescription drug reform laws. Together, these laws will make prescription drugs more affordable and more accessible, increase price transparency, and hold drug companies and corporate middlemen accountable. The first bill, which I sponsored, allows Maine to wholesale import prescription drugs from Canada. They are the very same drugs that we buy here, just that they're affordable over there. The second bill creates a prescription drug affordability board that will finally give consumers a voice in drug pricing, curb public spending, and help drive down costs. The third bill holds corporations acting as middlemen accountable for pocketing savings that are designed for consumers. And the final piece of this puzzle requires drug companies to share information on costs related to drug production, marketing, advertising, and consumer pricing. This is a big deal. In the absence of federal leadership, we did what Mainers do best. We stepped up and tackled the problem on our own, and now our leadership is getting national results. After passing legislation to create a wholesale importation program, here in Maine, it seems like the federal government is finally catching on. The Food and Drug Administration announced that we'll look into allowing states to import safe and affordable medication. This is a good first step, and hopefully the federal government will do its part to ensure that Maine can begin its wholesale importation program as soon as possible. All of the prescription drug reform laws will take effect on September 19, and it's my hope that Maine workers, families, and seniors will finally experience relief. Many of you bravely shared your stories, and it made a difference. We heard you, and we delivered. This is Troy Jackson. Thanks for tuning in.